Medicare Minute MD with Dr. Robert Hoover.
Hello, and welcome to Medicare Minute MD, a video and podcast series produced by the DME MACs for the benefit of physicians and healthcare providers. I'm Dr. Robert Hoover, Medical Director at CGS Administrators, the Jurisdiction C DME MAC. This series of videos, also available as a podcast, are tailored to provide important Medicare policy information for physicians and other healthcare providers who prescribe durable medical equipment or related services when treating Medicare beneficiaries. In our series introduction, I spoke about reasonable and necessary determinations versus benefit category decisions. Today, I'm going to speak specifically about another benefit category administered by the DME MACs, oral anti-cancer drugs. You can read more about this benefit category in our local coverage determination and related policy article on oral anti-cancer drugs. Just because durable medical equipment is in the name of our contractor type, it doesn't mean that we only deal with claims for DME. There are several other benefit categories under the jurisdiction of the DME MACs, including the one I'll be discussing today, oral anti-cancer drugs. This is another one of those misunderstood benefits in Medicare. While one might think from the title, oral anti-cancer drugs, that all oral anti-cancer drugs are covered, but that's not the case. Congress put limitations on this benefit. The statutory coverage requirements are shown on your screen now. For an oral anti-cancer drug to be covered, all of the criteria 1 through 4 must be met, and it's criteria 2 and 3 that are usually the ones that are misunderstood. To be covered, the oral anti-cancer drugs must have the same active ingredients as a non-self-administrable anti-cancer chemotherapeutic drug or biological. In other words, the oral anti-cancer drug and the non-self-administrable drug must have the same chemical and generic name, or it is a prodrug which, when ingested, is metabolized into the same active ingredient which is found in the non-self-administrable form of the drug. So for example, Xeloda, or capecitabine, is a prodrug that is metabolized in the body to 5-FU. Xeloda is covered under the oral anti-cancer drug benefit. Criterion 2 also highlights a situation where a treatment may be medically appropriate, but for which there is no Medicare benefit paid by the DME MACs. Take for example Gleevec, or imatinib mesylate, a drug used to treat a type of leukemia and certain gastrointestinal tumors. This drug is not covered under the DME MAC oral anti-cancer drug benefit. Why? Because it's only available in the pill form. There is no injectable form of the drug, therefore no Medicare coverage under the benefits administered by the DME MACs. Criterion 3 is also critical to understanding the statutory restrictions around this benefit. The oral drugs must be used for the same anti-cancer chemotherapeutic indications, including unlabeled or off-label uses, as the non-self-administrable form of the drug. So if the oral formulation has one set of cancer diagnoses and the IV formulation is indicated for a different list of diagnoses, there's no coverage under Medicare. That is why it's so important that you read both the local coverage determination and the related policy article for oral anti-cancer drugs. That's where you'll find the list of covered drugs shown on your screen now. And, more importantly, the list of covered ICD-10 diagnoses for each one of these drugs. The DME MAC medical directors review this list quite often to make sure that we're up to date with both the drugs and their labeled and unlabeled indications. That does it for this edition of Medicare Minute MD. As a reminder, you can download and print a written transcript of this program. And don't forget, this information is also available on podcast. Our complete library is located under the Education menu on www.cgsmedicare.com. As with all of CGS's educational offerings, this is only a summary of certain policy requirements. I encourage you to read the applicable LCD and related policy article for a complete description of the coverage, coding, and documentation requirements. Thank you for watching and have a nice day.